Hey folks, Nick the Nurse here. Today we're going to be talking about some of the nursing diagnoses that deal with the nursing problem of hypercalcemia. Now, understanding some of the nursing diagnoses and remembering them that relate to hypercalcemia are extra important because hypercalcemia often comes up in nursing school exams and possibly even on the NCLEX, so you need to be prepared. And if you're still in nursing school and probably in your clinical rotation, it's a good idea to be able to understand and memorize some of these nursing diagnoses to use in your care plan. So they serve a multitude of different purposes. Now, nursing diagnoses for hypercalcemia can include risk for injury. Why? Well, the patient who has hypercalcemia can suffer from a lot of secondary diagnoses or problems such as arrhythmias, right? Arrhythmias can put a patient at risk for injury, or fractures. Fractures are a big one. So a patient who has hypercalcemia can certainly be at risk for injury, particularly with their risk for fracture. So keep that in mind. Now, another nursing diagnosis can be impaired physical mobility. Why? Well, if you'll recall from our risk factors and causes video on hypercalcemia, we discussed how a patient who has been immobile and who hasn't moved around or ambulated is at extremely high risk for developing hypercalcemia. So we need to make sure that we develop a care plan that pertains to that particular nursing diagnosis so that we can get the patient back to their baseline or back to where they need to be. So that's uber important as well. Also, another nursing diagnosis that can pertain to hypercalcemia is imbalanced nutrition, more than body requirements. Why is that? Well, in this case, it might be that they have too much calcium in their diet. However, the inverse can also be said because a patient can also suffer from imbalanced nutrition less than body requirements. Why is that? Well, if you'll recall, when you have an increased calcium level, oftentimes the phosphorus level is going to be decreased. And the inverse can be said. When you have a decreased calcium, the phosphorus can be increased. So if the patient, has a decrease in phosphorus in their diet, or as a result of some type of hormonal or electrolyte imbalance, like hyper or hypoparathyroidism, the hormonal imbalance, this can lead to an electrolyte imbalance like hypercalcemia. So keep that in mind, because if I was a nursing instructor, that's what I would most likely test you on. So a lot of good info here to apply both on your care plans and on your nursing school exams as well. Again, my name is Nick the Nurse. I'd like to thank you for watching my video today. If you'd like to check out any of my other completely free videos, they're all located at www.nickthenurse.com, or feel free to subscribe to my free YouTube channel on my handle, Nick the Nurse. Thanks for watching. I'll see you next time.